Hi Lynn, how are you?
Yeah, I'm good, thank you.
I
Good.
know
How are you?
we just said hello to each other a minute ago. I know. Just making sure we're going online, girls. So just making sure that everything is being streamed, etc. Yeah, and we are. We're on the group. We're on the group, so it's all good. In technology, I just first of all, guys, welcome. I apologise that you can't see me clearly. It might not be a bad thing. Okay. I don't think the internet's too great out in the sticks. Okay. So, welcome, Lynn. Good to see you. Hope you've had a good week.
Yeah, I have. It's gone fairly quickly, I think.
Have you any idea which day it is today, Lynn?
I do. I do.
Yeah,
It's
yeah.
Friday, right?
You're in the minority because all of that most people haven't got a clue what day it is. Okay, fine. So last week, Lynn, we discussed obviously what you do, your background, and things like that, and then we went into giving a brief kind of introduction into the benefits of kind of like breathing, and also like the autonomic nervous system, what the body does at rest, and how stress kind of affects it. So we had a little chat before today, early on this morning, and we kind of you touched upon something which how can I say this? I think with my kind of background, I would say I've got to be careful here. I would say we're very much about the body, if that makes sense. Yeah, from a training perspective, it's all biomechanics, physiology, nutrition, etc. But you said upon something which is kind of like, and it kind of like rang true to me. It's kind of, yeah, that would be me. That about the mindset behind kind of when you are breathing and maybe the intent which goes into it. Would you like to expand on
Yeah.
that, Lynn? Because I think it kind of like thought I find myself saying, yeah, good point. So, over to you.
Yeah, we covered the like a brief how to on diaphragmatic breathing and this 4-7-8 breath, and what we didn't really cover was yeah, the attitude or what we're doing with our mind whilst doing the breathing. So
Yeah.
if we're coming into it and we're feeling quite stressed, and then we do the breathing practice whilst still feeling quite stressed, it's just going to reinforce that stress response. So we were talking about trying to lower heart rate and lower blood pressure and come out of the stress response.
Yeah.
Um, so it's about what we're doing with our minds essentially, but then also our approach. So as you were saying, I think from a training perspective and from physio, we're very goal orientated. Whereas for the breathing, it's not goal orientated. There's nowhere to go with it. It's about doing it as a practice.
Yeah. Yeah, cool. And
Yeah.
I'm just trying to relate it. How can I say this? That when people come in from a rehabilitation point of view, all they want to do is kind of like do more of something sometimes, or they want to kind of force it, kind of thing. So straight away, as soon as you said this, I can see that I get the point straight away because it's there's no point just trying to hammer away at something and just trying to force it. You've got to look to go for alternative kind of methods before you come back, and trying that what was previously feared, so to speak, and seeing how well you progressed in by getting strong, doing other things. Yeah.
Yeah. So it's so say with a 4-7-8 breath, it's breathing in for 4, holding for 7, breathing out for 8.
Yeah.
And although over time that will count will slow down and the
Yeah.
breaths will be longer,
Yeah.
um, and so they'll be slower. But the aim isn't to do as big a longer breath as you possibly can,
No.
which it's not competitive in that way. And a lot of us, the main person we're competitive with is ourselves, right? So
Don't
um,
point to me. Don't point to me.
trying to get myself there. So while we're doing it, although overall, yes, the evidence is for the slower, deeper breaths have got the benefits,
Right.
but it's about feeling comfortable. So as we're breathing, if our drive, our neural drive is the brainstem saying breathe, 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 because we're holding the breath and we're feeling it as a stress,
Yeah.
it's negating all the benefits.
Yeah, we're just layering things up and adding to things rather than actually getting what we think is going to happen from it. So what's your kind of process with regards to, I take it when you're doing your practices and things, you go through like almost like a warm up or a cool down kind of things to get people in the right mindset, ready to do the breathing drills. Is that good practice?
Yeah, I often tend to use the breathing as that centering, as that, as you say, kind of embodying practice. So if someone's finding it difficult, so the diaphragmatic breathing was the easiest, where you get your hands on your belly and just breathe as naturally as you can. You should feel that your breath, as your abdomen, comes out and in again. And if that's done lying on the back, that's the easiest position. Yeah. And to really tune into the feeling underneath your hands as your abdomen moves. So rather than thinking about how we're doing it or thinking about the instructions, we're feeling it. So it's about mind going into body, not in like the booking out sense, but you know, and just paying attention to the feelings rather than the thoughts.
Yeah, or what you were busy doing before you even came into the session.
Yeah, or what you're going to be doing afterwards, or the list that we have to do, or all those other things that we talk about. So the diaphragmatic breathing would be that kind of gateway, that's settling in.
Right, okay, fine, cool. How do you notice it as a practitioner with regards to different personality types and different, like I do, you tune into different types of people, undoubtedly. What's your kind of, if you've got somebody, and I'll put me in this bracket, who's on the go and has problems sitting still for 5 minutes, and thinks they're quite relaxed, but probably isn't. What kind of have you noticed with the kind of like the different personality types and the different with regards to have you noticed a difference in getting people into your program and into the breathing practices? And I'm just intrigued because I find more and more the way you coach people is determined by their personality. You know, there is no one approach fits all kind of approach. So do you kind of like modulate your kind of coaching and what are your kind of what are your kind of techniques for getting people who are on the go all the time or very stressed to kind of like buy into kind of the whole process of being slow? I remember when you first came aboard and did our staff training in preparation for the Move and Improve. I was the worst of the group in just being able to just sit still.
So I think, so certain people, so certain people aren't going to find it very easy to be still and to have that focus on breathing. And so it would be about bringing some movement in with it, which is a little of what you do or part of what you do in the Move and Improve, isn't it? Where I think where you the focus on the breath with movement is going to be an easier way in than just getting someone very still. And the same if someone's maybe quite anxious, then it can be, or past trauma, it can be really unsettling to be very still and very focused on the breath, in which case it's linking some movement with breath.
Yeah.
So in yoga, we've got the cat-cow, I don't know how you call it, where we're on falls and getting some spinal movement and linking that with the breath, but it can be any movement really.
Adding something in which they're more familiar with is a nice kind of segue into that. So rather than force feed people, rather than push people into something they're completely unfamiliar with, just kind of come towards them a little bit and make it something acceptable, I suppose, because once you've got the brain on side, the roles your oyster kind of thing, isn't it? Once you've got the client bought in and things like that, it gets easier.
Yeah. So I would tend to use spinal movements, pelvic movements, even just lifting the arms up and down, linking that with the breath, as a way of introducing it in a comfortable way. Yeah.
Okay, cool. And in your, when you've with your kind of work and things, Lynn, you obviously work with your two different hats on, the neurophysio and the yoga instructor as well. What have you found in particular, like the breathing mechanics and the kind of like the slow controlled exercise and the yoga? What's your kind of experience? Because it's, to a lot of people, this is still very kind of a holistic kind of area, isn't it? It's kind of like, how can I say it? It's not completely westernized yet, is it? It's still Eastern medicine. Me and you both know there's some really good science behind it. And I take it for a given now that when anybody comes in with lower back pain, the first thing I look at is breathing, but it's still not backed up by kind of like the Western approach as such. So who have you found the ability to help with, Lynn? And with regards to the kind of, I know you deal with, as you said, trauma clients, people in pain, etc. What would like tell us a bit more about how your approach is with that? Because it's something I think I give lip service to. We do a little bit of, but I'm keen to know your experiences.
So breath is one way in, because I think I was saying last week, it's a very physical, tangible way into our more emotional states or that side of what I do.
Yeah.
It just needs to be slow. It needs to be slow, really, and slowly introduced. I don't know. I don't think there's any particular formula for for introducing it, but through discussions with people and very much linking the so say for pain or say linking how stress is going to affect our pain or our bodies, but using a Western system, so using pain physiology and talking about the nervous system as a way of explaining those maybe more Eastern ideas.
Yeah, absolutely. With
it's bringing the two things together, and that's what's happening now anyway.
Do you see a direct kind of correlation between improving the breathing mechanics and its effects on pain? What's the kind of, I know, and I've struggled with this for years now, it's a hugely complex area dealing with people with pain, isn't it? What's your, if you can, and I'm sorry to put you on the spot here, what's your kind of, how would you explain the benefits? If I said to somebody coming to see us, just, oh, right, well, we recommend that you do some breathing practices for your pain. It's kind of like, well, we've been conditioned over the years that it's a medication job helping people with pain. Surely it's a, we can buy the fix off the shelf quite easily. What's the kind of, what would you say are the benefits of the breathing based kind of physiology in a kind of pain management situation, Lynn? Sorry.
Question.
Yeah, I know, but it's one I get asked, and you can throw it back at me if you want a bit later on.
So all pain is going to have a biomechanical, there's going to be something physical body-wise within it, but all pain is going to be affected by what's going on for us at the moment, what's been going on, our history, our experiences, all of those things. So if I was working with someone with ongoing pain, it's looking at all those aspects, all the pieces of the pie, if you like. And so although the breath work can have some physical effects, and the use of the diaphragm and how that, especially with back pain and groin pain and hip pain, it's coming back to that autonomic nervous system again and saying, well, if we are stressed, our body is more on alert, and we're gonna feel pain more than if we're in a less stressed state, and explaining it through that way.
I think that's really well answered. Sorry. No, it is though, isn't it? If as you just said, if you've got somebody who is in pain, the chances are they are stressed, and the more stressed they are, the worse the pain is probably go into field, and the more heightened the signal is. So just trying to, there might be the area of pain, the local area of pain, but just trying to think a bit more kind of globally, and look what areas you have got control of, and then work on the areas you have got control of. And breathing is one of those areas, isn't it? And just trying to lower calm the person down without being flippant. Okay, so yeah,
calm the nervous system down. And one analogy I like is the idea that, say you've got say someone's got back pain, and it's as if there's a faulty smoke alarm or sensor in there, some kind of alarm. And so by de-stressing the system, like by de-stressing the nervous system, it's just tampering down that sensitivity on the alarm. So rather than just firing off all the time, it's going to be a bit quieter. And so rather than being in pain quite so much, it's going to be a little bit easier.
Yeah, no, I think that's exactly the kind of approach, isn't it? And then it's trying to kind of help the person identify in the first place why those alarms get set off. One thing which I kind of think about a lot is people go to an awful lot of therapists, and they get treated, manipulation or whatever, but they never really get asked about what happened, and not what necessarily happened in the first place, but what keeps on setting this system off, what happens, what sets this alarm off all the time. So if you can identify the triggers in the first place, then I think that's got a massive kind of benefit. People are then educated about the awareness of what kind of, what they're doing to cause the issue in the first place. So cool. Now, Lynn, last week we did your breathing drill. How do we, you said about earlier on about integrating some movement. So for some people, you start off with movement, with breathing, and then with other people, you would start off just the diaphragmatic breathing. What's the kind of process? How do you kind of ascend that? How do you kind of progress your kind of your breathing kind of drills? Is there any hard science behind it, or is it just about what works for the individual?
Is there any science behind what approach for which person?
Yeah, with regards to breathing and the different drills you can use. Let's say, for example, you taught me to breathe from a diaphragmatic point of view, lying on my back, the easiest you can do. As soon as I sit upright, I get confused with my breathing because my body's got more to think about straight away. I then try and take it into some movement, and I'm absolutely baffled. Okay, is there a kind of, and I know this from doing like the kind of like more DNS work I've done and things. Is there kind of, is it just on a person to person point of view? There's no kind of fixed system at all, or does it just kind of vary by the person?
Definitely varies by the person. I haven't got a fixed, and I don't know of a fixed approach. Yeah. In the same ways that you do with your coaching, is if giving some kind of feedback. So whether that's the lying on someone's front, so someone can feel that the abdomen's going towards the floor, and giving that feedback in that way.
I think what I'm trying to say is that there's no such thing. If people have got to start somewhere and learn to master these kind of exercises and these movements. So even though you might not be able to breathe optimally through the exercises you give somebody, it's not the end of the game, is it? It's still beneficial just moving in the first place, if that makes sense. That makes sense.
From the moving
perspective,
absolutely. And going back to the actual breathing drills or breathing practices, if someone was to lie on their back and do really good quality, if you like, diaphragmatic breathing, and that's all someone did for 6 months, brilliant. And you can, someone can still get all the benefits from that. It doesn't have to, it's going back to that goal orientated progress, isn't it? It doesn't have to be, and so what's next and what's next. There's no hierarchy in that way. But adding complexity can advance the practices.
I think that's a really interesting kind of aspect, and I've had one of my most successful clients did the same exercise program for 6 months, no change, whatever. And all he did was be so consistent with it. You know, he did it three or four times a week, was starting from nothing at all. And it's just like you said, it's the consistency and probably the mastery which probably matters, rather than trying to, as you alluded to, trying to be focused on making it as complex as possible as soon as possible, which seems to be something we've been conditioned into thinking is the best way forward.
Yeah, yeah. And if someone was to do the diaphragmatic breathing for 6 months, say, which we do anyway, we're doing diaphragmatic breathing all the time, but say if someone was to do that, most people, the difficulty is that they get bored and someone wants to move on to the next thing. So that's when it becomes helpful, isn't it, to add in, to change something up, to make something different, just to keep our attention, rather than necessarily just because there's some physical need from a breathing perspective.
Yeah, cool. I just want to make sure I've given you a chance to answer the main thing we were saying about earlier on about the whole mindset, and of breathing and things like that, getting people engaged in the process. Did I give you a chance to answer that properly, Lynn? Because it's kind of, you know, when we go into doing these kind of things, do you try, and are there any skills you use to try and get people to focus, rather than just going straight into the drills? Have you got any kind of process you use to get people mentally involved? Does that make sense? Like, into your kind of session, do you set the environment up a certain way and things?
In the same way that you'd want to do it somewhere where you're not going to have lots of interruptions, or, you know, if we're all at home with children around and, you know, whatever, you know, people have working.
Absolutely.
So setting yourself up in that way, so it's going to be without distraction, having some moments to feel. So say if someone's lying on the floor or lying on the bed, to feel their body supported by the bed or what's beneath them. You know, people have heard of body scans, so having a little scan through the body to check in that way, and then giving it time. Most of it is just given time, and with attention, all the other stuff will come anyway. So I tend to call it from a centering point of view.
Yeah. No, again, it's just something I was thinking about. You know, from the environment, from a training point of view, we look at what's around us, make sure it's safe and all the rest of it, and then it's just kind of like go. But it's kind of, I'm just trying to think from a more kind of holistic point of view, and getting the people to, with what you're doing. I'm not saying the environment is any more important, but it's a different kind of environment to you make sure it's completely kind of ring fenced to get the optimal kind of results with regards to, is it less disruption, basically, isn't it?
Yeah. If someone's starting off, less disruption and more comfort. So making sure that someone's comfortable in whatever position they're in. And then it would go the same through the breathing practices. So as someone, say on the 4-7-8 breathing, say if someone was doing it and it's not feeling very comfortable, which it may not do depending on how people have practiced in breathing, then that's probably the trigger to stop at that point. You know, to make sure it's within comfort, and that comfort could be a physical comfort, but it can also bring up lots of feelings that aren't necessarily that comfortable, and so that might be the point to stop as well.
Okay, fine. Right. So last week we did the 4-7-8 breathing, Lynn. If we were at a stage to progress this, which we've said doesn't have to be the case, there's huge benefit just to do one thing and do it consistently. What would be an alternative? And I'm trying not to use the word progression because it doesn't have to be. What could you give us another practice to take away with this week, Lynn?
Yeah. So there's one called box breathing.
Right. Okay.
No. So it's used. Well, it's used in very similar ways in that calming down of nervous system, of bringing attention and bringing focus. So if you imagine a box or a square, and so as you breathe in, as if you're breathing up one side of the box, as you hold your breath along the top, breathing out down the other side of the box, and holding the breath out along the bottom. So each part of the breath, there's 4 parts, and each part is the same length.
Right. Okay.
Count. So someone's say breathing in for 4, holding the breath in for 4, breathing out for 4, holding the breath out for 4, and so you carry on like that, as if you're breathing around 4 sides of the square.
Speak in case you wonder why I was putting funny faces. So it's breathing in at one side of the box, holding at the top, exhaling down to one side, and then holding with your breath out at the bottom. Breathing in, holding, breathing out. Cool. Okay, so equal.
Very hard to do whilst talking.
Yeah, and also with things on your mind about doing an interview and all the rest of it at the same time. Yeah, absolutely. Cool. Okay, so the whole idea of box breathing, what's the kind of, again, what's behind it, Lynn? It's just, is it mastery of control? Is there a reason why we do the 4 sides or at all, or is it just awareness?
So all the evidence really is about a longer, slower breath. And so by adding in the holds, either in or out, is increasing the length. And the evidence shows for about 4 to 6 breaths per minute is optimal.
Right. Okay.
But that might not happen for a while. So that would be a count of 4. Yeah, but it depends on how quickly you're counting.
I'm not trying to catch you out. What's the normal respiration rate? I would
10 to 15 per minute.
15, is it? Yeah, fine. So and 4 to 6 is kind of optimal, they say. Yeah.
From the evidence, it seems to be that 4 to 6 breaths per minute is not optimal for everyday life when we're, going around and doing activity, but for the benefits of the breath practice, yeah. And the other thing that's happening with the breath holding is we're changing we're getting the body used to different levels of carbon dioxide.
Right. Okay.
And so the without, I have to have a think about this and come back to you with a clear answer. But so our drive for breathing is driven by carbon dioxide levels. Yeah. And by making changes to those levels can then have an effect on our nervous system.
Right. Okay, fine. Okay. Excellent. Yeah. Excellent. Right. Okay, fine. Right. Excellent. Okay. Lynn, thanks for your time. It's a fascinating area. I think I could talk to you forever about it. But it's also one of those areas which is kind of, how can I say it? It's, what am I trying to say? I'm trying to say that for a lot of people, I think they benefit hugely from it. I know from my own practices that the breathing with a lot of the people I use, it's so far off people's radar, isn't it? Sometimes that they don't quite realize where they've got to, because these changes don't happen necessarily just like that. They happen over a kind of, they can happen, I think, with trauma, but I think they can also just creep up over the years. So it's an area really that people should really get involved in and explore more. So next week, Lynn, what I'd love to do is talk a bit more about people, some of your experiences with people maybe in pain, or maybe just workshop kind of like a somebody, obviously not naming names, but a kind of like a situation or a client you've helped and how it's helped them. That would be kind of really fascinating. Okay, whether that's a lower back pain, or somebody who've an awful lot of people kind of getting used to new things at the moment and struggling. So I just like to see or like to hear how you kind of like really helped somebody in the process they've kind of gone through. Okay, because it's a journey, isn't it? Nothing gets fixed on one session. It's getting people into a kind of journey and into a process. So, and once they're involved and bought into the process, I think that's when the magic happens, isn't it? So be great to hear of if you can think of a kind of example, a kind of case study. I know, I think you've already had one referral today, which is great news, but I think you've got an awful lot to help people then, so it's cool. Okay, so if we could catch up next week and maybe we'll do another breathing drill at the same time, that'd be fantastic. Okay.
Sounds good, AD. Yeah, brilliant.
Right, Lynn, thanks for your time. We shall see you next week at the same time. Is that okay with you, Lynn?
Yeah, perfect.
All right. Okay, thanks for your time, guys. Keep safe and we'll catch up soon. Bye-bye.